Okay, let's go ahead and get started. I'm going to start off by saying thank you to our communications team. Danelle and Reed are a mighty team of two, and they are the reason that we are able to be here week after week. I just want to say thank you for helping us stay connected to the community. So I just want to acknowledge our communications team. Now I'd like to get into housekeeping. So, as you know, first, welcome. This briefing, as every week, will be recorded. We anticipate being able to send the recording out to you tomorrow, so you don't have to take notes, or if you're listening and multitasking, you will have everything that you need in the email that goes out to all those that are registered tomorrow. This session is going to focus on answering questions. So we're switching it up a little bit. Usually we have a presentation, but we have had so many questions that have come in. We wanted to start off by first answering the questions, and we see some themes arising, so we've consolidated those questions. And then if we have time towards the end, we'll allow for questions in real time, like we always do. But that being said, if you do have a question that comes up, go ahead and drop it in the Q&A portion of the Zoom call at the bottom of your screen, because then we can hold on to that and make sure that we get your question answered in the near future. And with that being said, next slide, please. Like to introduce you to our speakers again. First, we have Jane Demwobi. She's our Equal Justice Works Fellow attorney here at TJC. And then we also have Signe Anderson, who's our Senior Director of Nutrition and Advocacy. Next slide, please. And just to put out a disclaimer, the Tennessee Justice Center is a nonprofit, tax-exempt organization. We are nonpartisan and non-political. We are here for the community for factual information. The clients that we serve and the partners whom we work with represent the state's diversity of political affiliation. Our political analysis relates solely to the defense of health and nutrition programs, and do not imply or endorse or do not imply endorsement or disapproval of any party or person. I'm your moderator, and with that, we're going to get started. Just to give you a high-level overview, we're going to talk about the areas impacted by the mega bill. First, we're going to talk about TennCare/Medicaid. We're using those terms interchangeably because I know a lot of people orient to TennCare and some others are more comfortable with Medicaid generally. So we're going to start using both terms more consistently. For TennCare and Medicaid, we're going to cover nursing homes, eligibility and enrollment policies, qualified immigrants, rural health, and retroactive coverage. For SNAP, we're going to focus a little bit more on work requirements, the costs that will be shifted to states, SNAP education funding, qualified immigrants, so immigrants who might qualify, and then also the SNAP benefit amounts. Okay, I am going to turn it over to Jane to get started on answering the questions that have already come in on TennCare/Medicaid. Jane, take it away.
Thank you so much, Tanae. So just to set us up here, like Tanae just said, we're going to be talking about the most pressing impacts of the budget bill that passed into law. Just want to right off the bat, there are a lot of components of this bill, so we're taking the questions that we've received over the last call and answering the trends and what we feel you all need to know at this point. And just the same disclaimer we've been sharing, as the time progresses over the next weeks and months, we might learn new information that we'll then share with you at that time. So this is what we know right now about the most pressing issues and what you all have been asking about. The primary area that we want people to understand, and we get a lot of questions around, is eligibility and enrollment. This is who's on TennCare, who's eligible for TennCare, how do they get on the program, and can they stay enrolled? So the question that we receive the most often is, how will TennCare choose who will lose benefits? Because there's an understanding that the federal changes will result in a loss of benefits for folks who are already on TennCare. So everyone's asking who's going to lose their benefits and how they're going to lose their benefits and when are they going to lose their benefits. So I'll do my best to explain what we do know. So, just for folks to be 100% clear, the majority of the harm that comes from the federal bill is felt by states that expanded Medicaid. Medicaid expansion is an option that states have had for the last 10 years to expand the population that qualifies for the Medicaid program. So, a vast majority of states had already expanded Medicaid. Tennessee was one of maybe 10 states that have not expanded Medicaid in the last 10 years that the option was available. So the bulk of the savings that are being planned through the bill are because there are cuts happening to expansion states. As a non-expansion states, the changes to the program are going to look very, very different from what you might hear in the news and what you might see covered for the most part. So the focus in our state is going to be on red tape. So rather than the scenarios where particular categories of individuals will lose benefits entirely, the predicted loss is going to happen because there are going to be significant barriers, which we call red tape, that's going to prevent a vast majority of people from enrolling regardless of their identity. So what does this look like? Looks like barriers to enrollment in the Medicare Savings Program. So Medicare Savings is a program that is for people who are both on Medicare and Medicaid. And it basically offsets the premiums that those folks have to pay for their Medicare coverage. This is a huge benefit to folks here in Tennessee. About 280,000 people in our state are enrolled. But there are barriers. There are very complicated there are particular groups within the Medicare Savings Program, so it can be complicated to enroll and to stay enrolled. So there have been processes to improve enrollment procedures to make sure that there weren't barriers. This bill stops all that, so it prohibits enforcement of decreasing those barriers. What we're looking at is no mandate to streamline the application and enrollment processes or make renewals simpler. Just going back to what I was saying earlier, getting on the Medicaid program and staying on the Medicaid program requires a good deal of work on the part of the applicant. And there were efforts in the previous years to make it simpler for everyone to get on the program and to be on the program. Those efforts are now stalled. So because of the bill, their states are not the federal agencies and states are not allowed to enforce these kind of streamlining policies. So what's that going to look like? Increased churn. Churn looks like when a lot of people are eligible for a program but don't get the chance to enroll because they get kicked off just through the procedural barriers. That's called churn. And we can expect increased churn and increased administrative burden on the states and the individuals. So more people are going to be calling saying what happened to my health care. More people are going to be trying to find answers. More people are going to miss emails and miss letters sent to them in the mail. I mean, everything you can imagine that would result in someone who might actually be eligible not getting on the program is likely to happen. So the example for this is the COVID unwinding. So back in 2020, because of the COVID pandemic, there was actually a pause on people losing their TennCare because of everything that was going on. It was thought the last thing people need to be worried about is not filling out the right form to stay on TennCare. This was nationwide, so it wasn't just Tennessee. But here in Tennessee, when that pause ended, we saw for a period of 1 year, 70% of people who lost their coverage, who were seen as ineligible for the TennCare program, were actually eligible. So that's a perfect example of churn, a very recent one that we've just seen where there was a pause on people losing their coverage. So nobody got kicked off for a certain period of time. And then they started re-evaluating a large volume of applications. And as a result, a bunch of people got kicked off that should have never been kicked off. That's churn, and that's what we're worried about, and that's what we are expecting to see in this case. So the provisions go into effect immediately, but they go into effect at the federal level. A state still has to figure out how it's going to implement those changes. It's going to look different in every state. So the timelines are going to vary. So that's the biggest impact, is the red tape, is the churn, is the lack of simplicity and the potential burden on everyone who goes through the process. Another major component of the bill's impact is on rural health. So the major concern going into some of the votes around the bill was rural health and rural communities. This is because rural areas are already struggling to with access to healthcare, because hospitals being closed because they're not profitable in many rural areas in Tennessee. So one of the ways that the architects of the bill were trying to address this problem, and again, it was kind of as a last resort, was through the Rural Health Transformation Program. So you'll see an amount circulated, $50 billion set aside to address healthcare access in rural areas. That is the sticker amount that is allocated to this rural health program. But the breakdown looks a little bit different. So I just want to talk about that. You're going to see about 10 billion. First of all, you're going to see half of that is going to be distributed to states, and then half of that is going to be distributed to all states, and then the other half is going to be distributed on a case by case basis. So you're looking at about $10 billion annually for 5 years that states will receive as a grant. So they have to apply and be approved. So $10 billion is set aside annually for states to receive as a grant over 5 years. 5 billion of that 10 billion is going to be distributed equally, like I said. And then the other 5 billion will be discretionary. So we're talking about the federal agencies making a decision on a case by case basis about whether a state is going to receive additional funds after that first 5 billion is allocated. So 5 billion across 50 states for all the states that of the 50 states that are approved. And then maybe another 5 billion will be spread out across the few states that are seen as qualifying. So we don't know what if the decision is made on a case by case basis, we don't know what will qualify a state. It's said to be dependent on need and rural population. So some states might be seen to need it more than others, but there's no clarity about how the administration will decide to distribute those funds and who it will favor. So $50 billion allocated, half of it will be given on a case to all states that apply for the grant, and then the other half will be given on a case by case basis. So it's hard to say exactly what it will look like in Tennessee or in other states, but that's the structure we can expect over the next 5 years. So the amount of the fund, it was cobbled together to kind of account for the concerns folks had around rural health, but it's just, experts say it's not enough to offset what will happen to rural communities if these cuts go through. State budget, this is the other big question we get. What is the impact of the federal changes on Tennessee's budget? So the version of the bill that was signed into law actually does not make significant changes to Tennessee's budget. At various points, there was a risk that there could be chunks taken out of how much Tennessee receives from the federal program. But actually, because of what I explained earlier, how the bulk of the damage will be felt by states that have expanded Medicaid. As a non-expansion state, Tennessee, with a reduction, is going to be because Tennessee is going to spend less on care in the long term. Why? Because there will be fewer people enrolled in the program. They're going to save money and spend less on providing coverage to people because there will be less people to cover. So we've talked about this many, many times. We've reinforced it as much as possible, but the worst effects of the federal changes will actually be on individuals who are struggling to enroll in the program or keep their coverage. So just as one example, when you break down that 1 trillion that's been circulated as how much the federal savings will be over the next 10 years, you're looking at 122 billion federal savings just from eligibility changes. So that is one component. And going back to what I said earlier, they're predicting that it will be so difficult for people to enroll, and so fewer people will be on the program that they're going to save 120. The Medicaid program will save $122 billion. So that's what we're talking about when we say when we talk about eligibility and enrollment. is because less people will be on the program and then it'll cost less. That's what the savings look like. And a quick one here is retroactive eligibility. So if you are eligible for Medicaid and if you apply and you're eligible for Medicaid and you're pregnant or a child, you actually get retroactive coverage. This means it dates back going to the days before your application. This is really helpful for folks who end up hospitalized and for whatever reason can't apply for Medicaid the day they get in there. They might be hospitalized for a few weeks or a few months before they're able to figure out their TennCare. So it covers their medical bills going back 3 months because in a lot of cases, well, in the case of retroactive eligibility, you were eligible, you just didn't apply because you were in the hospital. So it makes sure that you're not burdened with medical debt for that period. So that just looks like a decrease from 3 months to 2 months. There's no change in who's eligible. It's just that there's going to be a decrease in how long that retroactive coverage goes. So instead of 3 months of medical bills being covered, it's 2 months. And of course, when there's a decrease in coverage, that just signals increase in medical debt. And then folks have a lot of questions about particular TennCare programs, like Katie Beckett is a popular one. So the TennCare programs, as to my explanation earlier, there are no targets to any specific TennCare program like Katie Beckett or others, because that is just not how the final version of the bill was structured. It's much more likely that individuals, regardless of what program they're on, will struggle to get their benefits. So I just caution folks from worrying about any particular TennCare category they might be in or someone they know will be in. We don't necessarily want to start speculating that or we can't, and we shouldn't speculate that any particular program will be targeted. It's more so that there are going to be these barriers put across the board that will affect you regardless of your program. So no direct concerns about Katie Beckett or other programs. However, one of the impacts of the bill is to stop the enforcement of a process that was actually increasing nursing home staffing standards. So this is really important. Nursing homes are a huge part of the Medicaid program. About 60% of residents of nursing homes are on Medicaid, or in Tennessee and TennCare. It's critical for coverage in that group. And nursing homes have also had concerns around quality. So are folks being fed and taken care of, getting their medications and all of that. So there was a rule that was implemented, a federal rule that would have required states to increase the quality and the number of staff that are employed in these nursing homes so that people are getting the care that they need and they should be getting, the quality of care they should be getting. This bill removes that standard. So now we have a system where nursing homes across the state with tons of Medicaid residents are potentially less safe and have lower quality of care. So that's the kind of thing that we see. It's taking away the processes that were improving people's experiences on Medicaid. It's not that it's targeting a particular program or demographic. Work requirements. So folks have been asking, and we just want to be clear, the bill's work requirements don't apply to Tennessee because we have not expanded Medicaid. So that is really critical. The work requirements provision is for expansion states. However, the bill does endorse work requirements, which has not been, this is the first time that work requirements are imposed in the at the federal level for the Medicaid program. So it's creating an attention and essentially an endorsement, like I said, of work requirements that might trigger Tennessee to impose its own. So this is a concern because actually Tennessee has tried this in the past. So in 2018, the state submitted a waiver to impose its own version of work requirement, but the federal government never acted on it. It's been years and we don't see a path to where the federal government will approve that previous waiver. But it does raise some concerns. Tennessee has tried to impose its own work requirements in the past as a non-expansion state. The federal bill targets expansion states, but is now kind of making it the norm to have work requirements. We don't know what Tennessee is going to do. And Tennessee's version of work requirements has been harsher than what was in the federal bill. So should the state move forward following its previous efforts, it looks like we'll have a harsher version of work requirements in our state. But again, we don't believe that the federal government can approve the previous waiver that Tennessee attempted on work requirements, but we don't know what efforts the state will go through to maybe reinstate that. So we just don't know on work requirements, but the federal bill doesn't affect Tennessee. Immigrant access. So we have a couple of questions about how the bill will impact eligibility for immigrants trying to enroll in Medicaid. So the core of it is that the bill changes which immigrants can qualify for TennCare. This is really important because previously refugees, asylees, and trafficking victims could get Medicaid coverage, at least for a limited period, despite despite their immigration status. There are limits on which immigrants can get covered under TennCare, but these three categories were permitted. Now, this bill changes that. Refugees, asylees, and trafficking victims are no longer eligible. What's staying the same is those with a green card, Cuban and Haitian entrants, their eligibility is unaffected. Folks are wondering whether Tennessee will cover pregnant women and children who are refugees, asylees, or trafficking victims, but we have to wait and see if Tennessee is going to choose to do that because it is a state's choice. Provider taxes. We've talked a lot about this, and I've got a couple questions. So people are wondering, how do provider taxes work? So the impact of the bill on provider taxes will again be worse in non-expansion states. In a state like Tennessee, the bill will not have a significant effect because our tax rate for provider taxes is high enough that we won't be affected by the limits that the federal bill is placing. So Tennessee's existing tax rate is at the maximum, and so we will not be meaningfully affected. So just to minimize any concerns there. And last but not least, the marketplace. This will be a lot of our focus moving forward. The 628,000 Tennesseans are enrolled in the Affordable Care Act marketplace, and that is who will be primarily affected here in Tennessee, in addition to what I mentioned earlier. So the enhanced premium tax credit is what makes the marketplace affordable for many families because the monthly premiums are very expensive. Those tax credits expire at the end of the year. So if there's no renewal or extension of those tax credits, families are facing about a 75% increase in their monthly premiums per household. That is a huge financial burden that folks are facing. So the next fight is extending the premium tax credits. The bill does not mention the enhanced premium tax credits. So it's not that it prevents them from being expanded or extended, it just doesn't mention it. So there are other channels to actually advocate for these premium tax credits to be extended past 2025. And that's what we'll be talking about moving forward. So that about does it for Medicaid. There's quite a lot to take in, but we try to condense everything. So as always, we're available for more conversations, but I hope this was helpful for folks just kind of keeping track. Thanks, Tanae.
Thanks, Jane. And just a reminder to everyone on the call, please, if you have questions, if you need clarification, please drop those comments in the Q&A portion at the bottom of your screen where it has a little question mark so we can make sure that we are able to lift those up. And if we don't have the answer right away, we will get back to you either in writing or on the next call. Signy, you are up to talk about all of things SNAP and nutrition.
Thanks, Tanae. And thank you everyone for being on today's call. I think we can move to, yep, thank you very much for that slide. I'm gonna transition us to the SNAP budget and how the cuts will impact the SNAP program in Tennessee. We have lifted up that it's an estimated 186 billion in SNAP cuts that are going to to come forward because of the cuts. And this is a federal cut. This is what it looks like across the nation. $186 billion will be cut nationally from the SNAP budget. But I think it's helpful just to give a quick Tennessee breakdown, and we'll get into this a little more in some of the other questions. One of the major costs for states is the cost shift. States in the past have paid a portion to operate the program through administrative costs. That's always been shared 50-50 by states, and the other 50% being paid by the federal government. That has increased to a 75% burden on the states. And the other major cost shift that has come to states is the cost of the actual benefit. States have never been responsible for paying for the benefit amount. It's always been 100% funded by the federal government. This is the other piece where the federal government will save a lot of money because they're passing that cost to the states. And so we will see major costs for the administrative side of it. We've done some estimating based on past costs for the program. So for the administrative side, the additional cost to Tennessee is an estimated 67.6 million in new costs, and that's a yearly cost. And that is effective as of October 1st, 2026. For the fiscal year 2027. The SNAP benefit cost, again, in the past, Tennessee has spent $0 on the SNAP benefit cost, and we can anticipate anywhere from 162 to $243 million in new costs every year, and that's effective October 1st, 2027 for the fiscal year 2028. And again, both of these estimates are based on what the state has paid in administrative costs in the past. The first data point, the 67.6 million, is based on 2023 data that we have, and then the SNAP benefit amount is looking at the 2024 data. Again, people will be cut from SNAP sooner due to the work requirements and limited immigrant eligibility. The big cost shift is going to come a little bit later, as I've noted here, so fiscal year 2027 and 2028. And we're still waiting on guidance for states, which is forthcoming, as to how the work requirements will roll out. And I'll get into all that in a little more detail in the following slides. We can go to the next slide. All right, another question that we got was on the SNAP error rate. And the question was, is the 162 million in extra SNAP costs for Tennessee expected because of the error rate, or from keeping people who whole if the inflation rate is frozen? What is the current error rate for SNAP? So just to dive into this in a little more detail, as I mentioned on the previous slide, it is the error rate that leads to this additional cost for us. States, depending on where their error rate falls, will have to be responsible for more of the benefit amount, and a larger penalty to the state to pay more of the benefit amount. So Tennessee has kind of fluctuated in where our error rate is, and that's normal for states. And I would emphasize too, coming out of the pandemic, states have seen higher error rates because they're just trying to right the ship since the pandemic and all that was involved in running the program during those times. Tennessee's error rate in 2023 was 12.56%, and an error rate at that level would make Tennessee responsible for the highest benefit amount, so up to 15%. Just to clarify, states with a high error rate, an error rate above 10%, will have to fund the highest amount of benefits, which is 15%. So that is the $243 million in new costs. So if our error rate stays high, over 10%, we would be responsible for the greatest amount of benefits. If we remain under 10%, it'll be closer to a 10% cost to the state. So that would be a closer to 162 million in new costs for the state. If folks have questions about this, we can talk about this in more detail. But just to be very, very clear, this was always covered by the federal government. These are complete new costs to us, and we are now responsible for paying a portion of the benefit amount. And our estimate here is based on the amount of benefits that came to Tennesseans in 2024. I know for those of you who've been on previous calls, we've shared that in 2024, there was $1.62 billion in SNAP benefits that came directly to individuals, to Tennesseans. And so this is based off of that estimate from the 2024 benefit amount. The other thing that I think is important to note too on the SNAP error rate is the SNAP error rate doesn't measure fraud. The SNAP error rate is how well the state is doing on determining how much benefit an individual must receive. And that's based on income, and for seniors on medical costs. And sometimes the state gets it wrong, and when they get it wrong, that contributes to their error rate. So sometimes we see the state giving individuals too much benefit. Sometimes we see the state not giving families enough benefit. And every time they make that mistake, that contributes to their error rate. So this is a state administrative error that's being penalized. And the other thing that I would note is that fiscal penalties already exist for states with high payment error rates. And so this is something that's being added onto states in addition to what's already been in play for a long time with the SNAP program. And we can move to the next question. All right, work requirements. So for SNAP, there are work requirements. There have always been work requirements for the SNAP program, but now these work requirements have expanded underneath the bill. And the question here is, will the Tennessee Department of Human Services, TDHS, need new software to implement the new work requirements? That's the first question. And the answer to that question is no. DHS does not need new software, but they must provide guidance and train their staff, and that is all pending, waiting on USDA to distribute that guidance to states. The second part of the question was, is volunteer work allowed? Is it counted towards the work requirement, or is it just paid work? And yes, volunteer activities do qualify for the work requirement, but must be approved, and you must find and maintain that paperwork from whoever the organization or the company is that you're volunteering for. So it's a lot of paperwork and administrative work that goes into determining the work requirements. And we can go to the next question. All right, next question. If Tennessee raises the approximate $230 million for its share of the SNAP benefit and administrative costs, does that mean 134,000 Tennesseans would lose SNAP? So just to clarify this, I think in one of our last briefings, we were talking about people impacted by the work requirement. So the answer is no. The 134,000 estimate is based on the number of people who would be responsible for the work requirement. So that's the estimate in what the drop in enrollment would be for individuals being impacted by the work requirement. And just to remind folks of who those folks are who are now going to have to adhere to the work requirement, that's adults up to age 65. Right now, the age limit is up to 54. It's 18 to 54 is the age range for people who currently have to adhere to work requirements. And also added to this underneath the new bill are households with children ages 14 to 18. Again, SNAP has always had work requirements, but it's never been applied to individuals with children. Now that rule has changed, and raising children underneath this bill's this bill's rule, raising children does not count as work. And I think many of us on the call understand that raising children is indeed work. It's unpaid work, but it's not counted underneath this bill. The other thing that changes as well, veterans, houseless individuals, and children aging out of foster care are now no longer waived from the work requirement. This population of folks was added and waived from the work requirement in the past reconciliation bills a couple of years ago, but they now must adhere to the work requirement or prove that they are not able to work. So again, that's an added burden to the individual as well as the state. This is going to create an immense administrative burden, not just to the people that we're trying to help connect to the program, but to the state itself. Let's see, I want to make sure that I answered everything on that slide. All right, I think I'm sure there may be other questions on the work requirement, but I'll move on because I know we have quite a few questions. The next question is there any correlation between SNAP cuts in the proposed $7 billion in cuts to the education department? So the proposed cuts to the education department was announced, I think, during our last briefing. There isn't a direct correlation between the SNAP cuts and the proposed cuts to the Department of Ed. However, we are monitoring the details of those proposed cuts because they could potentially have an impact to the school meal program. And so we will continue to monitor that and share any information that we get moving forward. All right, we're ready for the next question. All right, can you explain how Tennessee choosing not to use federal funds to pay for a summer EBT program led to decreased summer meals for kids, and how that raises concerns about decreased SNAP funding? So for folks who might be new to summer EBT was created before the pandemic as a pilot because many families struggle with food insecurity that spikes for low-income families during the summertime. And so summer EBT was a pilot that USDA created back in 2011. Tennessee participated in the Northeast in 2018 as a pilot state. And then the pandemic came and it created pandemic EBT for the entire country. And then last year, 2024, was the first year that Congress made summer EBT a permanent program that states could opt into. And Tennessee opted in 2024 and was very successful in operating the program in 2024, reaching 700,000 Tennessee children, which was great. And we heard from so many families who were supported by summer EBT. They were able to buy healthier food because of it. But it provided a small benefit during the summertime for families with children, with school-age children, to spend in the grocery store. The governor cut this program in 2025, so families are not getting it this summer, unfortunately. And I think the best way to look at this is it's just another source of funding that the state could be tapping into that we've decided not to. And so when we see the SNAP cuts coming down the pike pretty immediately with the work requirement piece, and many of those families are now in that category of work requirements, not only have they lost the summer EBT program, but these families with children, school-age children, may start losing SNAP. And so it's kind of a double whammy for those families losing this support. So we are continuing to monitor the summer EBT program and advocating for the state to return to funding that program in 2026. There is a small administrative cost for the summer EBT program. So factoring that in addition to the SNAP costs and the benefit amounts in moving down the line, that could be just another a factor that makes it difficult for the state to choose to do summer EBT. But again, summer EBT this past year, the state would have been responsible for up to $4 million in administrative costs to run the summer EBT program, which is just a fraction of what we're talking about for the administrative costs and the SNAP benefit amount that we are likely to incur in the years ahead. So that's just a quick, a somewhat quick overview of summer EBT and the concerns about decreased funding for SNAP. We can move to the next slide. All right, next question. Could you comment on the increased frequency of the enrollment requirements? So this is something that could potentially come into play with the states being responsible for keeping their error rate down. Because states are trying to monitor and make sure that everyone is receiving the proper benefit amount, they may require a much more frequent re-enrollment so that they are constantly checking whether or not people are getting the right benefit amount. So the increase in the frequency of re-enrollment requirement is likely a result of the scrutiny of the state's payment error rate. And the passage of the bill states that with a higher payment error rate, it requires them to pay a greater portion of the SNAP benefit. So it's just the re-enrollment requirement is another way for the state to constantly check to make sure that they're keeping their error rate down, which ends up being a huge administrative burden for the individual, as well as a bigger administrative burden for the state. All right, we can go to the next slide. The next question, if another organization or person steps up to give SNAP beneficiaries food, do the beneficiaries have to report to the SNAP authorities that they receive food so that their benefit gets lowered by that amount? There is no penalty to anybody who participates in SNAP if they supplement their groceries by getting food at the food bank, from a neighbor, from a service like Meals on Wheels, or any other community outreach program. In fact, it's very common for individuals to visit both the food bank and receive SNAP. SNAP benefits, I will just remind people, SNAP benefits are meant to be supplemental. They provide on average $6 a day for somebody to buy groceries, which is not a lot. And in a large portion of our seniors and houseless individuals, people on fixed incomes, this is all they have. It's not supplemental for some people. So they do have to rely on these other sources, and it's not required that they count that towards their SNAP. We can go to the next question. All right, actually, I think, well, let me see. Yes, I think this is one more question that we have coming in. How can organizations respond to individuals who fear for public benefits just because they are immigrants? We have seen a lot of these questions since the new administration has come into office and with the crackdown on immigrants. Again, if someone is a qualified immigrant, they should proceed with applying for SNAP. But I will say it's a very narrow group of individuals who are eligible for SNAP. In the past, it's always been refugees, asylees, people who are victims of trafficking, Cuban entrants. Most of those individuals under this new bill have been cut from receiving the SNAP benefit. But for now, if someone is a qualified legal immigrant, they should proceed with applying for SNAP and Medicaid. However, if you are in a mixed status household, just to be clear that there is cause for concern, as of July 18th, CMS announced that it will share Medicaid participant data from all states with ICE. So that's a real concern. And so folks need to take that into consideration if they decide to apply. USDA is also currently tied in litigation over trying to access similar SNAP data. So there's some gray area on SNAP, but people should still have that information before they decide to apply. We are informing individuals of the risk of their data potentially being shared, and letting participants make an informed decision about applying just with that information on hand. For the WIC program, I want to make sure that folks know that WIC does not have a documentation requirement. They do not require citizenship. They require the address of where you live. As long as you're a Tennessean, you have a Tennessee address, you are eligible for the WIC program. There's no citizenship test for the WIC program. So let us know either for SNAP and Medicaid or also for the WIC piece if folks have questions and need any help with connecting to these programs. We're happy to dive into that with folks. And another resource to lift up, the National Immigration Law Center, NILC, they have some really good resources to help families during this time. And so we have their resource linked here in this slide. And then I think the last slide that I have, or Tanae, is that last slide for you or for me? One more for me. Got it. Okay. All right. The last question is, how should we be thinking about election cycles when it comes to the impact and the timeline of these provisions? So the Medicaid provisions impact TennCare before midterm elections in November 2026 are bulleted here below, prohibiting the enforcement of nursing home staffing rules, stopping further implementation of the eligibility and enrollment final rule. And then the third bullet there, expired premium tax credits. The majority of the impacts will come into play actually after the midterms, just to clarify there. Most of those impacts will come into play after the midterms. On the SNAP side, the SNAP provisions that impact Tennesseans before the midterm elections in November 2026 are the work requirements. That's something we are expecting to see soon. Right now, we've heard from DHS that they're waiting for information from USDA, but the thing that we can expect pretty immediately are work requirements and the ban to certain legal immigrants from enrolling. And we will, again, keep folks updated on these weekly briefings as soon as we know more information about when that goes into effect. The other thing that happens before the midterms is the cut to SNAP Ed. SNAP Ed funding has been provided to universities and groups across the state to help give education and information about addressing obesity, stretching benefits, the benefit amount to stretching your benefit dollar in order to buy the healthiest food possible with the small amount that you receive in SNAP. And this funding has been cut completely, will be cut completely starting on October 1st. The other pieces that we will feel after the midterms is the 75% administrative costs and the increase in the SNAP benefit match as well. So those major costs to the state will come into play after the midterms. And I think that's the last of the questions. I'll turn it back to you, Tanae.
Thank you. Okay, we have time for a couple of questions. Signe, I'm going to stay with you and about the error rate. First, you listed on the slide that there are error rates for 2023 and 2024, not for 2025. Do you know when the error rates for this current calendar year will be calculated? And then the second part of that question is, help us understand how error rates show up differently in different states. Gordon mentioned in the chat that there might be a benefit for Alaska being able to delay paying or a grace period for paying their benefits. So help us understand that a little bit more.
Yeah, so it always takes time for this data to be processed. So we can expect the 2025 error rate information in 2026. And we might get a snapshot before, but unlikely. Like getting the full picture of the 2025 data will come in 2026. And then Gordon lifted up a good point in the chat. In order to get the bill over the finish line and to get certain Republican votes, they did some deal making around the error rate. There are a few states that have had really high error rates, Alaska being one of them, and I forget the other state. I think Texas, maybe. There have been a couple of states that have been in the same boat as Tennessee, but are seeing a much higher error rate. And so those Republicans cut a deal saying that if we have a really, really high error rate, can we be waived of this for a couple more years? So it doesn't really make a lot of sense. But there are a couple of states who have such a high error rate that are going to be exempt from paying a portion of their benefit immediately. They have a couple more years before they're able to do this. But Tennessee, our error rate is still high, but it's not high enough. So we're gonna have to pay a good portion of the benefit amount. We fall in that area where the state's going to be responsible to pay a pretty significant cost.
Okay, thank you, Signe. Jane, I do have a question for you. And this might be for both Jane and Signe, but Jane, we'll start with you. When we think about work requirements, how does it impact caregivers of adults with disabilities? Are caregivers exempt, and also caregivers of disabled dependents age 14 or older? The second part of that is, will an individual experience a benefit gap as their child reaches an age requirement? Like, will it just cut off? And then help us understand for those that are self-employed, what do they need to do to prove employment? We'll start with Jane and then come back to Signe.
So just to be clear so no one gets confused, because the work requirements in the federal bill affect expansion states, anything that I just quickly recap does not apply to Tennessee. But I know folks are curious about what is in the federal bill. So in the federal bill, yes, the work requirement applies to parents and caretakers. So that's that category of people on Medicaid who have a child or dependent 14 or under 14, so 13 and under. If the caretaker is disabled, if the child has a disability, or if the person you're taking care of isn't a child and they have a disability, you will be exempt from the work requirements. That's under the Medicaid provision. Again, we don't have to worry about that in Tennessee, but I thought I would mention that for folks, because I know folks always kind of want to know what the age limit is. So that's the deal in Tennessee. I don't have any details on self-employment income or what the transition looks like, because we haven't dug into that for our state. So I'll leave that to Signe on this now.
Yeah, I can share a little bit about that. I mean, generally, the state might look at tax returns or profit and loss statements. Oftentimes, it requires the individual to do a self-attestation, is what it requires of the individual. But again, Jane mentioned this. I briefly touch on this. This is a lot of paperwork and a lot of just proving that this is my situation. And so we see people fall through the cracks all the time because of the paperwork burden for the way that the current work requirement is set up. And so this will increase that burden significantly. We will see so many more people being required to send information like this to the state, and the state will have so much more that they have to process in order to make sure that people receive their SNAP if they're proving their work piece. And I think we've also shared in the past that because of this burden, we're likely to see many people decide not to apply because it's either they're not getting a response from DHS, or they've been asked to provide information that's impossible or they're not able to provide. So yeah, it's where we're anticipating a lot more red tape and burden there.
Thanks, Sydney. So before we come to a close, I just wanted to cover a few more slides. First, the next slide, please. This is a fact sheet that we just created. We are going to be sharing information in fact sheets. We found that this is helpful for people to understand the timeline, just so you can sort of have it at hand, quick and dirty. And so as we received information, we will update and share additional information, but this is the information that's pertinent for this week. Thank you, Jane, for pulling this together. So next slide, please. So as we say every week, we are going to leave here doing some work. One, we're going to register to vote or verify our voter registration if we haven't done that already. Encourage people in your network to register to vote. We update consistently on our website and on social media, so follow us on all of our social media platforms. I know as I'm talking, our comms team they're dropping links in the chat, and you will get this PowerPoint presentation emailed to you if you to all the registrants. So no need to take notes right now. And then stay informed. So stay connected with us so we can send you just in time information. But we are still going to engage, and we are engaging with Congress. They need to know how you feel about the policy changes that we discussed today. So we encourage you to keep elevating your voice, keep letting them know your thoughts, letting them know the impact, and asking questions, because a lot of times they don't have the details that we have. So keep in touch with your members of Congress. So, okay, stories. Stories are everything. So I always say no stories without data, no data without stories. We collect stories here at TJC, but sometimes they're formal. They don't have to be. We need to understand from you all what the impact is to you, your family members, your clients, the community members that you are working with. You can share that information with us at tnjustice.org/stories, or the call-in number or email. So tell us your stories so we can better understand the impact and be able to communicate that effectively like we've been doing the entire year. If you have questions, please reach out and contact us. Our email addresses are on the page, or they will be shortly. There we go. Follow us on our social media handles. And then, just in case you're interested, we do have recurring events. Our Ensure Our Kids call and our Health Advocacy Roundtable call. We're doing some changes with timing, so stay tuned for information about that. But we do have WIC champions, SNAP access, healthy meals, Healthy Kids meeting, and then the summer EBT advocacy group. So these are just additional ways to lean in for connecting with other stakeholders and also to receive additional information. Thank you for your time today. Sydney and Jane, thank you very much for all of your knowledge and for doing the hard work and making sure that we have this information. Until next week, everyone, stay safe and stay engaged.